بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about peritoneal calcification. Peritoneal calcification is seen in limited number conditions that results in peritoneum calcification, and the differential diagnosis is small and include psammoma bodies as we seen in malignancies in patients, most commonly and frequently in patients with cyst adenocarcinoma of ovary. Also, psammoma body are around microscopic calcific collection. It is a form of dystrophic calcification and can be seen in other conditions like papillary thyroid carcinoma, papillary serous carcinoma of the endometrium, melanotic schwannoma, meningioma, mesothelioma, serous cyst adenocarcinoma of the ovary, and adenocarcinoma of the lung. Also, the peritoneal calcification can be seen in the patient with pseudomyxoma peritonei and present ring or arc-like calcification, most numerous in the pelvis. Patient with TB peritonitis can also present with calcification, meconium peritonitis in a newborn, and differentiated malignancies, dystrophic calcification within the tumor. Also, peritoneal oil granulomas also can lead to calcification. Patients with dialysis can lead to calcification, especially patients with continuous ambulatory peritoneal dialysis. And infection can lead to calcification like pneumocystis carinii, hyperparathyroidism, and post-operative heterotopic ossification also can occur. Let us see some examples of peritoneal calcification. Here, a patient with serous ovarian adenocarcinoma, and we see multiple calcification in the peritoneal implants here, as we see. And this is small, and these are macroscopic nodular large calcification. Here, another patient with papillary serous adenocarcinoma of the ovary, as we see here, and with multiple calcification. And we see also the calcification here in the ligamentum teres, and the calcification here in the Lissau sac. Here, another patient with calcified implants seen in patient with ovarian cancer, and these are peritoneal carcinomatosis. Here, another patient with large calcification due to with peritoneal deposit and calcification of the ovary and the ovarian tumor. Here, another patient with undergoing continuous ambulatory peritoneal dialysis, and we see here calcification, sheath-like calcification around the spleen around the peritoneum, around the liver here also, and the calcification is extended to the ligamentum pelvis. And we see here this is the peritoneal dialysis catheter. Here, this patient with calcification, peritoneal calcification, and here we have end stage calcification of the renal transplant. Here another patient with calcification, peritoneal calcification, and we see here the peritoneal dialysis catheter. Here another patient with peritoneal fluid and peritoneal calcification, sheath-like calcification in the peritoneum, lining the small bowel and associated with thickening of the mesentery. And also there is a fluid in the pelvis here, and these are sheath calcification. Another patient with the calcification also and the peritoneal dialysis with extensive peritoneal calcification as we see here, and it is surrounding the fluid. Another patient with peritoneal calcification and patient with dialysis and thickening of the peritoneal lining. Extensive calcification surrounding the bowel, and this is can cause sclerosing peritonitis due to peritoneal dialysis. And here another patient with chronic peritoneal dialysis with ascites, and we see faint-like sheath calcification and obstruction, bowel obstruction also seen with bowel dilatation. Here, this is another patient with bacterial peritonitis, demonstrated loculated ascites with calcification, and here one of the differential diagnoses of the encapsulating sclerosing peritonitis. Peritoneal dialysis is one of the causes. Here another patient with calcification here with multiple cysts. This is a hydrated cyst with calcification. Here this unit with multiple calcification seen and with real atresia due to meconium peritonitis. And here we have the gastrostomy tube seen. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.